Understanding medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy as taught at the Blue Heron Academy of Healing Arts and Sciences, Part 1. Hello, and welcome to this presentation on medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy as they are taught and practiced at the American Medical Massage Association National Training Center, the Blue Heron Academy of Healing Arts and Sciences. Dr. Lawton founded the Blue Heron Academy in 1980, and since that year, over 14,000 students have studied and trained in the advanced systems of medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy. Dr. Lawton is a licensed chiropractor, napropath, and acupuncturist, as well as a certified naturopath with over 50 years of experience in manual therapy practice and education. My name is Chrissy Dawn, and hopefully I will be your guide to a better understanding of medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy. Let's begin. The development of homeosomatic medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy at the Blue Heron Academy. The following presentation introduces the development and delivery of a system of medical massage therapy and medical manual therapy called homeosomatic, and a system of manual therapy entitled Scandinavian mobilization therapy. These systems of manual medicine have been developed by Dr. Gregory T. Lawton over the course of his healthcare practice and teaching career at the Blue Heron Academy of Healing Arts and Sciences. Briefly, the word homeosomatic is a trademarked term that was created by Dr. Lawton in 1980 to describe his theory that the most effective methods of treating the human body, in conditions of disease and pain, would encompass processes that mimicked the body's own self-healing and restorative capacity. The word homeosomatic simply means that the body likes or responds to forces that are most like the body's own physiological and biochemical functions. For the sake of convenience, and for most of this presentation, I am going to refer to medical massage therapy and medical manual therapy simply by the abbreviation MMT, and I will refer to Scandinavian mobilization therapy as SMT. The Blue Heron Academy, founded in 1980 by Dr. Gregory T. Lawton, is a state-licensed post-secondary school that specializes in preparing students for careers in MMT and SMT. The Blue Heron Academy has developed a highly specialized training program in MMT and SMT that is based on the latest research in the fields of manual therapy, manual medicine, biomechanics, neurophysiology, and pathology. The Academy's MMT and SMT curriculums are based on unique concepts in treatment, and the Academy has developed new techniques and treatment protocols that are not based on standard or general massage therapy programs or systems, such as therapeutic massage. The Academy now trains several hundred students per year in its headquarters school located in Grand Rapids, Michigan. The Blue Heron Academy belongs to numerous national associations and has program approval for its MMT and SMT certification courses through the American Medical Massage Association and the American Manual Medicine Association. As mentioned before, the Academy was founded by Dr. Gregory T. Lawton, and he teaches classes at the school. Dr. Lawton is a licensed chiropractor in Michigan, a licensed napropath in Illinois, and a certified acupuncturist in Idaho. The Blue Heron Academy Medical Director is Linda Hegstrand, MD, PhD. The Academy has developed a national and international reputation for its MMT and SMT training programs and is a model training center for the American Manual Medicine Association. Massage school directors and instructors from massage schools across the USA come to the Grand Rapids Academy for training in the MMT and SMT techniques. The Academy specializes in providing evidence-based clinical training in MMT and SMT therapies. All the training and education at the Academy is directed at providing its graduates with effective, practical healthcare treatment and professional consultation skills and abilities. The Academy's courses in medical acupuncture, clinical herbal medicine, clinical nutrition, medical massage therapy, medical manual therapy, and Scandinavian Mobilization Therapy offer Academy students the ability to combine various courses of interest and the opportunity to become multi-skilled healthcare professionals. The Academy's training programs have attracted nurses, physical and occupational therapists, and physicians interested in complementary and alternative healthcare. Because of the Academy's focus on manual medicine, students receive highly concentrated training in these areas and do not have to take unrelated classes. The Academy routinely receives students moving from colleges into the Academy courses because the Blue Heron program is a hands-on and clinical skills-based approach. In addition, all the Academy training programs are designed to support and augment each other, providing ongoing educational and curriculum continuity as students move through the entire Blue Heron Academy training program. Blue Heron Academy graduates have graduated to successful private practices, been hired by hospitals, chiropractors, physical therapy clinics, and sports teams. The recent history of medical massage and medical manual therapy. Many of the Western systems of conventional massage therapy, especially technique taught in the United States, are based on the general techniques of Swedish massage. The origin of Swedish massage was for some time erroneously attributed to Per Henrik Ling. Ling's theories were thought to have been popularized by a Dutch physician, Johann Metzger, but later, historical investigation led to questions regarding Ling's involvement in the development of Swedish massage. Regardless, in 1892, Emil Klein, MD, PhD, wrote in his book, Handbook of Massage, regarding Ling and Swedish massage, "But on the other hand, Ling's activity suffered from certain unfortunate defects. He lacked scientific training and was ignorant of medicine." Prior to the development of the generalized and nonspecific techniques of Swedish massage, massage was almost universally used for medical purposes. It was with the popular spread of Swedish massage, regardless of its origins, that many of the higher-level skills of medical manual therapy were lost. During the last half of the 19th century, the medical profession discovered massage. Thereafter, its language, applications, and training began to change. It was in the 1800s that massage therapy had a resurgence and was being practiced by a wide variety of physicians and therapists. This was a time of experimentation, discovery, and renewal. Osteopathy was born, and so was chiropractic. Naturopathy came along in 1906 as the last of the great arts of manipulation born in the United States. Nurses routinely studied and practiced massage in hospitals, and the great medical spas and health centers operated successfully. But then came the antibiotics and miracle drugs, and that was the end of that. Until now. Manual therapy is experiencing a slow and gradual movement within the healthcare professions towards higher levels of academic standard. With longer periods of study, it is gaining entry into the profession by allied medical personnel and acceptance into colleges, hospitals, and medical clinics. Often, however, the highly generalized format and techniques of Swedish massage and relaxation massage therapy do not meet the clinical needs of a medical environment. MMT and SMT are emerging as systems of treatment that address the needs of a medical environment within which patients are treated for specific musculoskeletal disorders, pain, and disability. MMT and SMT achieve these goals because 1. MMT and SMT are not a general massage treatment. Rather, they are applied as manual therapy to the specific area of the patient's problem. 2. MMT and SMT are delivered to a body part or region after clinical assessment. 3. MMT and SMT protocols involve several steps or stages of treatment which attempt to correct abnormal conditions affecting a joint or soft tissue. 4. MMT and SMT are not limited to myofascial tissues, but include highly specialized joint capsule and ligament therapy. 5. MMT and SMT adopt the medical techniques and protocols of other conventional systems of healthcare. Swedish and therapeutic massage employ generalized massage techniques such as gliding, kneading, striking, shaking, and friction. MMT and SMT utilize the same techniques as soft tissue pre-treatment for the deep tissue and joint treatment that follow. MMT and SMT employ a relaxed hand technique referred to as the soft hand. This hand technique allows deep tissue penetration without patient discomfort and without making the patient's condition worse. MMT and SMT utilize patient positioning and soft tissue folding to reduce muscle tension and muscle contraction. MMT and SMT techniques combine joint movement techniques directed at all the joints and the soft tissue that is attached to the joints. These joint movement techniques are based on the normal physics of joint motion and include torque, shearing, accommodation, and traction-distraction. The techniques of Castle and Smith are also employed. The Castle technique includes shaking the arm or leg, and the Smith technique involves the use of a bony lever and hand contact that moves the joint and gently stretches, exercises, and stimulates the ligament of the joint. The homeosomatic systems of MMT and SMT are highly specialized systems of soft tissue therapy that are based on theories and research regarding tissue healing and physiological homeostasis. These systems of therapy recognize that the joint capsule and its attached soft tissue structures, especially ligaments, are the primary sites of pain and other abnormalities. The MMT or SMT therapist also uses exercise, heat, cold, and patient education in a treatment plan that helps patients recover from their problems. The MMT or SMT therapist uses manual procedures in a specific treatment plan. The manual treatment plan is provided to the patient by the MMT therapist for the purpose of 1. To prevent connective tissue degeneration. 2. To maintain full normal range of motion in joints. 3. To reduce soft tissue inflammation. 4. To reduce patient pain. 5. To provide patient education and to encourage patient compliance with exercise and self-care instructions. 6. To reduce stress to soft tissues and the body. The MMT or SMT therapist must learn how to assess soft tissue conditions. When a manual therapist palpates soft tissue and determines tissue tension levels or stiffness, a shortened or weakened muscle, or locates a trigger point, that is assessment. MMT or SMT therapists must learn how to treat patient conditions. Many MMT and SMT therapists are qualified members of the medical community, nurses, physical therapists, and occupational therapists who are adding manual therapy to their practice skills. They can legally treat patient conditions. In addition, manual therapists working under the supervision of an allopathic, osteopathic, or chiropractic physician can also treat patient conditions and pathology because they are working within the scope of practice of the licensed physician. The MMT or SMT therapist needs to be focused on the patient's problem and recovery. MMT and SMT techniques are corrective and restorative. The MMT and SMT training programs take the developing therapist and systematically teach them how to treat the acute and chronic patient conditions that they will see in the most common patient complaints. The MMT and SMT therapist is trained in the use of various topical liniments, ointments, or medicated oils that are normally used at the completion of the treatment session for special therapeutic purposes. The training of the MMT and SMT therapist is based on standard medical terminology, record keeping, health sciences, and clinical approaches of patient care and management. The MMT or SMT therapist is comfortable in medical and clinical environments and can speak the language of medicine. The MMT or SMT treatment is, however, not a medical model, nor is it allopathic. MMT and SMT are touch therapy, and as such, their primary mechanisms of effect on the human body are holistic, natural, and psychosomatic. The MMT or SMT therapist is capable of operating and maintaining a professional and competent clinical office environment, while at the same time providing all the holistic benefits of manual therapy. Who says that professional capacity, clinical competency, and business mastery are incompatible with healing? The MMT or SMT therapist is trained to work in a variety of healthcare settings, including private or group practice, holistic clinics, hospitals, medical and chiropractic clinics, rehabilitation and physical therapy centers, and adult care facilities. Because of the diverse practice opportunities available, the MMT and SMT therapist needs to be trained in medical office operations, administration, and billing procedures. An individual who is trained in MMT or SMT manual therapy can work in any environment, especially medical, chiropractic, and clinical facilities. The general massage therapist, who is only trained in relaxation massage, on the other hand, is not trained or qualified for these clinical positions. Training should also include practice in administrative procedures that include the use of medical case or SOAP notes, medical diagnostic and procedure codes, and medical report writing. Training should also include record maintenance, confidentiality, and HIPAA requirements. Billing codes, medical terminology, and record keeping are simply a necessary part of doing business in healthcare. Whether a therapist chooses to bill insurance or not, if they treat any patient condition, a headache or a sore hamstring, they are required by law to maintain written records. MMT and SMT students should be required to complete formal patient records and case files during their practicum and internship components of the training program. In the event of a malpractice suit, the only proof against any allegations may be case notes and written patient records. In the absence of this written documentation, courts tend to accept and favor the testimony of the complaining patient. Fundamental concepts in addressing and treating the MMT or SMT patient. Manual therapists who treat pain, chronic pain conditions, degenerative joint disorders, and neurological conditions need specific training in the neuropathology of pain and the neurophysiology of musculoskeletal disorders. They also need to understand the correct procedures for the treatment of pain and how to properly address the patient and place the patient in the most effective and comfortable position for treatment. For purposes of MMT and SMT education, correct procedures include 1. Patient subjective pain assessment and evaluation for type of pain and degree of pain. 2. Patient placement on the treatment table in a position that is most comfortable for the patient. 3. Surgical draping of the patient to expose only the regional area of treatment. 4. Extremity or regional positioning to place the area of treatment in a relaxed or neutral position. 5. Folding of the area of treatment to encourage further tissue relaxation and to allow deep tissue penetration with minimal pain. 6. Use of a manual therapy soft hand technique, as opposed to a stiff hand, to allow comfortable tissue penetration. The soft hand is strengthened from the inside of the hand. The therapist hand is firm but relaxed. The penetration is deep but not invasive. 7. Observation of a clinical response in the tissue in the area or region of treatment. The essential importance of the joint complex in MMT and SMT and dyskinetic aesthesia. Many chronic pain conditions, not directly caused by neuropathic conditions, are caused by joint inflammation and degeneration. The MMT and SMT therapist specializes in the treatment of joint disorders. The joint complex is the complete joint structure, including all attached connective tissues, nerves, vascular components, and lymphatic vessels. This joint complex system involves the mechanical, fluid dynamic, and nervous aspects of normal joint function. MMT therapy is highly effective in the treatment of chronic progressive joint degeneration when the goals for treatment include reduction of the patient's subjective pain, reduction or elimination of inflammation in the affected areas, and restoration of normal range of motion in the affected joint. The MMT therapist focuses on the joint complex for the purposes of 1. Stimulating soft tissue repair, regeneration, and remodeling by using research-proven methods of corrective and restorative therapy. 2. Decreasing connective tissue fibrosis, contraction, and adhesions through specialized methods of soft tissue elongation. 3. Decreasing soft tissue edema and normalizing tissue fluid dynamics via specialized methods of tissue compression and connective tissue mobilization. 4. Facilitating normalization in the efferent and afferent neural signals that travel to and from soft tissue structures through the peripheral and central nervous systems. 5. Provoking soft tissue repair, regeneration, and remodeling by stimulating the biochemical processes of healing. Dyskinetic aesthesia is the term developed by Dr. Lawton to describe the negative feedback loop and somatic learning processes that affect normal joint complex neuromechanical function. The body is a learning organism that adapts to survive and procreate. When negative feedback and behaviors become normal, as in the case of chronic pain, then the body has adapted to and adopted behaviors that produce and represent a diseased or abnormal state. In the example of pain, this adaptation and adoption of pain causes a cascade of negative emotional, biochemical, and mechanical events that cause a progressive degenerative breakdown of the body's cells, tissues, and organs. More clearly stated, abnormal joint function, with its altered neurological and mechanical states, causes disease and disorders in other body systems. Pain is more than an annoying occurrence. It is a form of sensation and communication that alters joint function. Pain can either be a part of the process of correction and restoration of normal function, or it can be a part of the progressive degenerative change seen with chronic joint stress. Pain, if allowed to continue unabated, will result in abnormal CNS adaptations and modification of normal joint function. Neither of these behaviors is desirable. Soft tissue injury and the joint complex are poorly understood and are often incompetently treated by the allopathic and osteopathic medical communities. Often, surgical intervention and chemotherapies do more harm than good, either by directly contributing to the maladaptive responses in the joint complex by failing to address the problem, or by interfering with the delivery of appropriate and effective MMT or SMT therapy and corrective and restorative techniques, protocols, and competent care. The use of therapeutic modalities in the MMT and SMT practice. Therapeutic modalities are the use of adjunctive clinical techniques in the treatment of various patient conditions. Manual therapists have long employed these methods, which include heat, cold, vibratory or percussion devices, soft tissue lasers, electrotherapy, topical applications, liniments, compresses or medicated oils, and other procedures. Therapeutic modalities are frequently applied in 15-minute increments. The use of these modalities imparts the following benefits. 1. Provides beneficial physiological responses. 2. Prolongs the patient visit and the perceived value of care. 3. Allows the therapist to treat multiple patients per hour. 4. Reduces patient fees per visit. 5. Provides an affordable fee structure and appointment compliance. 6. Broadens the therapist's scope of practice and effectiveness. 7. Diversifies the therapist's daily activities and reduces burnout. 8. Reduces ergonomic stress to the therapist. The MMT and SMT approach to therapeutic modalities recommends only those modalities that are the least invasive, and so therapies such as ultrasound and diathermy are not included in this outline. Current scientific research questions the effect of deep heat from ultrasound, diathermy, and medical lasers on the DNA and RNA of the cell. In addition, there are currently many questions regarding electrotherapy's effect on nervous and brain tissues. MMT and SMT therapies also embrace the latest research on the role of nociceptive input and pain, and the importance of stimulating the mechanoreceptors that dampen nociceptive input. The MMT and SMT therapist recognizes several physiological avenues of clinical response in connective tissue that result from manual therapy, including 1. Mechanoreceptive and nociceptive somatosensory responses. 2. Direct effects on the microanatomy of the cell. 3. Regenerative capacity of connective tissues, ligaments, and the joint complex. 4. Biochemical hormonal pathways, such as natural opiate production and neurotransmitter release. Therapeutic modalities may be employed in clinical practice by the MMT or SMT therapist to achieve certain specific therapeutic goals during the treatment of a patient. Central concepts of medical manual therapy, combining science and therapeutic applications. This presentation on homeosomatic medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy should provide the student with a clearer understanding of the unique characteristics of this system of corrective and restorative therapy that is taught at the Blue Heron Academy of Healing Arts and Sciences and through the American Medical Massage Association and American Manual Medicine Association. Some components of homeosomatic medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy, specifically bony lever technique, are modifications of the original and brilliant work of Dr. Oakley Smith, medical researcher, chiropractor, and naturopath. The homeosomatic system has also adopted some of Dr. Smith's theories regarding ligament pathology and the avoidance of provoking pain receptors through the stimulation of pain receptors and by causing deep hyperesthesia. However, it has been over 1 century since the advent of Dr. Smith's work, and much has been discovered about biomechanics, in particular about soft tissue trauma and disorders. As a result, contemporary homeosomatic medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy are representative of these advancements in knowledge and application of the science of manual medicine. Other components of the homeosomatic system of MMT and SMT have been specifically developed by Dr. Gregory T. Lawton over the last 50 years of his clinical practice as a manual therapist, naturopath, chiropractor, and medical acupuncturist. What is solely unique about this system of manual medicine is its adoption of current cutting-edge research from multiple medical and scientific fields and the development of manual therapy techniques and protocols based directly on this research. Also unique is that the research and techniques of the homeosomatic system are based on valid concepts of normal neurophysiological function, and not on non-physiological theories, as is routinely seen in other popular, faddish, and generalized massage methods. It should also be clear that the homeosomatic system of MMT and SMT therapies incorporate their own diagnostic methods, scientific terminology, and highly specialized treatment protocols for the treatment of specific musculoskeletal and neuropathological conditions. This has been your narrator, Chrissy Dawn, and it has been my privilege to hopefully guide you towards a better and deeper understanding of medical massage, medical manual therapy, and Scandinavian mobilization therapy. This has been part 1 of a 2-part presentation. I look forward to connecting with you again in part 2 of our presentation on understanding medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy as taught at the Blue Heron Academy of Healing Arts and Sciences and through the American Medical Massage Association and the American Manual Medicine Association. Thank you for your kind attention during this important presentation.